With the end of the year fast approaching, the final push to close member gaps has started. The annual election period for Medicare Advantage is right around the corner, and preparations to enroll new members and retain existing are in full swing. Soon, the annual notice of change will be sent to inform members of changes in cost and coverage. Now is also the time for plans to revisit their member engagement strategies to ensure they don't lose their members during the next open enrollment period. A proactive, multi-channel approach to member engagement can significantly improve gap closure, member satisfaction, retention, and plan growth during the remaining months of 2024 and the start of 2025. Today, Leah and Becca will review strategies to proactively identify members in need of outreach, communicate using an omni-channel approach, including multimedia for optimal engagement, ensure awareness of upcoming plan changes, and garner feedback on interactions with the plan and its providers. So without further ado, let's turn it over to Leah.
Hello, everyone. Thank you. I'm glad to be here today. We're going to start our conversation today with a poll. So please look at your screen and which key areas are you most focused on right now? ANOC and AEP, annual enrollment period, dual enrollments, health equity, or gap closure. Please enter your responses and we'll share in just a few minutes. Thank you. Let's see, are we ready to share? More trickling in. All right, so I'm happy to share that majority, 80% of you are focused on gap closure. Not surprising, it is the end of the year and STARS and HEDIS measures are coming to a close. But a good portion of you are still concerned with ANOC, although September's here, dual enrollments and health equity. So thank you so much for your participation in the poll. So let's get into it today. I wanted to start off our conversation today and set the stage for our focus on Medicare. Medicare, as you know, is a cornerstone of American healthcare over the years, and Medicare Advantage plans has certainly been soaring, and enrollment continues to rise with over half of Medicare members enrolled in an MA plan in 2024. Medicare Advantage popularity has really been driven by many factors, including enhanced benefits, cost savings, and the increasing prevalence of managed care models. The growth of enrollment reflects that broader trend in healthcare where beneficiaries are seeking that integrated coordinated care options. And MA plans provide that. Improvements in design plans, greater provider networks, and additional benefits, dental and vision. Racial and ethnic diversity has also increased in Medicare Advantage plans in recent year, with those members opting into MA plans. Again, mostly because of the cultural relevant care they're able to receive and very personalized care within your MA plans. There's also been a notable increase in beneficiaries at a lower age range, as indicated by early retirement. But it's no wonder why this population is key for us to focus on today. We're also discussing populations to target on. We want to give you that highlight of duals and D-SNP members. Dual special needs plans are a crucial component of Medicare Advantage landscape, as you know, and they're really designated to serve those members who are dually eligible for both Medicare and Medicaid. D-SNPs have become increasingly popular among those organizations. Again, they can tailor benefits to the special needs of the population, and these have grown over the years. You can see here in 2024, it's almost doubled since it's been in 2019 and prior. These D-SNP plans have the ability to really address those complex needs of those dual individuals, and members get added benefits, low costs for premiums, deductibles, again, dental, vision, and other services, transportation services, fitness and wellness programs, and additional money to pay for things like food and groceries using flex cards. There's over 12 million members duly covered, and the growth of D-SNP plans continues to rise. More than 6.6 Medicare beneficiaries are enrolled in a special needs plan. However, no challenges do persist. One key area is many are not aware of key benefits. Nearly 3 million seniors could benefit from a low-income subsidy program but are not enrolled. And continued improvements need to be made for care coordination and addressing social determinants of health and improving health outcomes. recent years have seen a concerning trend in the quality outcomes for these plans. This graph is from a recent article by McKinsey called Future of Medicare Advantage. So check that out. I think the link is in the slides. This shows that plans with a higher percent of D-SNP members have lower HEDIS rates and scores and sharper declines year over year. This trend highlights the ongoing challenges and needs for improvement in the care delivery of this very vulnerable population. Now more than ever, plans need to focus on better relationships with providers, enhancing member engagement to close gaps, and really identifying members with social risk. So let's get into it. What do you do now? So in the next couple of minutes, we'll talk about this idea of just-in-time outreach. So these dates are likely engraved in your brain if you are in a Medicare Advantage plan. This is timing is everything, right? Right now, we're approaching the annual notification of change letters that need to go out to members. Very soon after, we'll come into the annual election period, followed by open enrollment. And don't forget about a new CMS requirement that requires you to notify your members mid-year in July of 2025 if they've not used their supplemental benefits. But are you effectively communicating with your members? Are your outreaches and resonating with your members? Recent study has shown that only 48% of Medicare beneficiaries say they carefully read the mail from their insurance company. And almost just a third say that that information is understandable. I think we can do better. This is concerning that less than half read it, with 10% actually saying they throw it away, and only a third finding it understandable. So there's definitely ways we can improve our communication to these complex situations and challenges within the healthcare space. With clear and proactive communication really plays a pivotal role for communicating with our Medicare and Duals membership. Let's talk about why this is so important. So effective communication, as we know, is very important in reaching your members, engaging with your members, being a trusted partner as a health plan. But even more so now, the importance of the Medicare changes and CMS changes is for you to be able to effectively communicate these changes to your members. And a February 2024 study by the Commonwealth found that 3 in 10 Medicare Advantage members didn't use any of their supplemental benefits in the past year. And this is not as surprising, as we said at the beginning. The benefit of Medicare Advantage plans is all these supplemental benefits, such as dental, vision, hearing, fitness benefits, and other supplemental benefits. And it's important that members use these benefits because another study showed that the members using supplemental benefits had an increased likelihood of getting their annual well visit and having those preventive screenings that are so key to HEDIS metrics, and keeping out of the emergency room. So really an important area for you to focus on. In addition, we mentioned lots of changes to the Medicare Advantage plans. In 2025, Medicare beneficiaries will not pay no more than $2,000 out of pocket for prescription drugs covered under Part D. This cap is likely to lead to thousands of dollars of savings for your members who take high-cost drugs for cancer, rheumatoid arthritis, and other serious conditions. It's key to communicate that change to them and let them know what drugs are covered and let them know that you're there for them if they have changes related to the benefits or questions on their benefits. And lastly, use communication to connect with new plan members, new to members to the D-SNP plans. Capture social determinants of health through surveys or HRAs or health needs assessments, and then address those needs. Transfer members to community-based organizations and help them with other social barriers to help improve outcomes. So we focused a little bit on when, who, now let's focus on how. So how can you use member engagement strategies to support? Well, certainly there's a variety of different ways, using omni-channel approaches, but some key things come to mind. First, keep your communication short. With this ANOC changes, this can be a short email or IVR blast to the members and refer to those the letters that you did send. So maybe they don't throw this away and they actually take the time to read their changes to the benefits. Follow up with text messaging and always communicate with culturally competent messaging. Second, Medicaid and Medicare members are continuing to be more digital savvy. Digital first strategies are probably a part of your outreach campaigns today and use them. Use MMS capabilities. It's shown here on the right-hand side of the screen. This is a short video or a picture, really captures the attention better than just a text message. You can even send a V card with your health plan phone numbers so the members can contact you, or a short video on the importance of staying connected with your health plan. Flu season's here, so capture your members' attention with a picture. And I know for myself, I would definitely gravitate more for a picture than just words on the page. And finally, your health plan call centers may need some extra hands or some extra agents. Another great way to be more efficient in your campaigns and outreach is to leverage IVR, cast a wider net, and to engage in transfer programs. Engage members, hook them, transfer to your call center to address those social needs, or transfer them to other live agent programs to extend your resources at your health. Next, I'm going to share with you a case study on one health plan that did just that. We worked with a large national health plan who reached out to us for help with their extra help program, this is the low-income subsidy program that allows members in the Medicare Part D to receive free prescription drugs. But members have to apply for this benefit every year. And so this client wanted us to reach out to their members, engage with their members, and help them with completing the paperwork for this needed benefit. The outreach was an omni-channel approach, so IVR, SMS, connected to live agents. Of the 27,000 members that were outreached to, 81% of them were reachable by IVR, and 93% were reachable by text. And the live agents connected with 25% of the members and completed 56% of applications, helping members really navigate that complicated forms, but getting the benefits that they are eligible for and can definitely use. As a result, the health plan saw an increase in number of members who were able to receive the benefits and no-cost drugs. Next, we'll address how you can prepare for some additional upcoming changes and develop year-round engagement plans. So the first change I would highlight here is CMS certainly introduced several key changes with its ongoing effort to improve care quality. One of them is the Health Engagement Index. If you support Medicare and STARS, you're keenly aware that this index is introducing to the 2027 STAR rating year. This index aims to reward Medicare Advantage and Part D plans that deliver higher quality care to underserved populations, including those with social risk factors like low income, dual eligibility, and disabilities. These vulnerable populations are already showing declines in HEDIS measures, as the McKinsey study showed, and the Health Equity Index will really shift dollars that plans receive for STAR performance. Government savings are in the billions over the next 10 years, but plans can act now to ensure they keep their bonuses and improve quality outcomes in their members. So what can they do now? First and foremost, I think it's most important that they find those eligible members. To find the low-income subsidy members, payers can use claims, but also go beyond claims, using social economic status data, open source geospatial data, as well as conducting HRAs and health needs assessments and surveys related to these needs to identify those members who might qualify. And beyond just Medicare Advantage members, payers can also look at the commercial or individual plan members who might be aging into the plan. They should integrate communication and outreach strategies that align HEDIS measure results with outreach campaigns to address gaps in care. Use predictive analytics to stratify likely to engage populations or populations with higher clinical severity and evaluate the progress of outreach over time. This can help identify those members who are always compliant versus those that may need a nudge every year. And CMS is continuing to emphasize cultural competency and new requirements related to those individuals with limited English proficiency. And so again, plans need to ensure their communications are culturally appropriate. In order to reach and impact member behavior change, we need to communicate often and promote a positive member experience. Next, I'm going to turn it over to Becca.
Thanks, Leah. So we have a second poll question up now asking how you communicate with enrollees most often. Take a moment and let us know what channel of communication you use the most. We have IVR, SMS, For texting, MMS or texting photos or videos. We also have digital communication via websites or member portals, as well as mail, email, and call centers or live agent outreach. I'm guessing that most plans are using a wide variety of different forms of outreach. So again, just let us know which method is used most often. Okay, and no real surprise here. We are definitely seeing shifts in communication methods. Of course, mail is still number one, but we are starting to see shifts away from mail communications. Of course, you have to send out specific communications via mail as necessary per CMS, but other communications are definitely shifting away from mail to either call centers, emails, SMS, and actually IVR as well. All of these channels are very important. Regardless of the channel you use most frequently, delivering appropriate communications is vital when it comes to member engagement. Medicare members represent a diverse population with varying levels of comfort and access to technology, so it's important to use an omni-channel approach. For those of you who deliver communications via your website or digital portal, here are some ideas that can be used to improve member satisfaction, support health outcomes, and assist in closing gaps throughout the year. First, collecting SDOH data via health needs assessment and health risk assessments through a secure portal allows plans to gather actionable insights with an enrollee's non-medical needs. This data can also capture member satisfaction with the health plan, which helps tailor services and improves care experience. We'll get into an example of this in a few moments. Secondly, sending digital reminders to schedule appointments with primary care can be an essential tool in addressing social risk factors and chronic health needs. These reminders directly support CMS STARS ratings by ensuring members are using preventative services and chronic care management, which are key to improve clinical outcomes and will help with coding and retrieval efforts in the long term. Finally, by integrating the portal with call centers, health plans can engage members and connect them to appropriate resources, addressing social determinant of health issues like food insecurity or housing assistance. This proactive outreach closes care gaps and enhances both member satisfaction and plan performance, driving better health equity and stronger STARS ratings. If done correctly, it can also lessen administrative burden. On the next slide, we have a case study that demonstrates these three ideas in action. A regional health plan launched a secure digital survey in combination with an IVR call to assess member health needs, capture barriers, and connect members to services. This is done for about 200,000 members annually. Over 30% of members engaged provided key insights for the health plan, such as those listed to the right. The calls asked members questions on demographics, 88% of which were willing to provide their race, and if they currently have a primary care provider, their housing and transportation situation, financial status, mental health needs, and more. This invaluable information empowered care managers to extend personalized support and assistance and redirect care to appropriate resources. If you want to read more on this study, a white paper is available on our website, so please check it out under the resources section. We recognize this example is merely one part of member engagement, so we created a sample communication plan to run year-round with areas to target during specific times of year. As we review the plan, be mindful of the ultimate goal of an engaged member to take action with their health. So first in January, start onboarding communication. This can include sending out welcome kits or communication blasts to explain plan benefits, provider network, and how to access services like preventive care when not to use the emergency department. Personalized outreach like phone calls and emails can also guide members through initial steps, ensuring understanding of coverage. Also, you may want to include incentives for completing health assessments or participating in wellness programs, all of which can identify health equity needs early to create proactive care plans. Then early in the summer, the opportunity is with quality outcomes. Care gaps should be closed throughout the year, of course, but in this is the time of year to be proactive in outreaching to members who need preventive services or care management, sending them reminders via the phone, mail, or digital channels. Then in late August, early September, focus on scheduling appointments. While members should have been making appointments throughout the year, this time is your last effort to really satisfy STARS measures and addressing health equity, and by ensuring and also ensure underserved populations are receiving high quality care. At this time, you may also want to remind members about available telehealth services, which can be particularly helpful for members residing in rural settings or those with more mobility challenges, especially members who are approaching 75 years and upward. Finally, start creating and sending surveys and assessments to ask members for their feedback. This will give you a good gauge as to how they will answer their CAHPS questions overall next year, as well as alert you as to actionable items that can be impacted through intervention. Now is the time to plan for next year to design and approve content that will lead to member retention. Channels should be maximized and optimized throughout the member's journey, from onboarding to surveys to end-of-year gaps in care. We do have one final case study to share that pulls in two of the aforementioned topics of care gaps and surveys. A large national payer with both Medicare Advantage and dual plans contacted us to determine the best way to close gaps in Medicare medication adherence for their population. By including survey questions as part of a telephonic outreach, they are addressing barriers to members taking prescribed medications, such as issues with cost, transportation, understanding the doctor's instructions, and side effects. Overall, this group had a 46% engagement rate when asked about the pharmacy benefit. 95% of members reported having their prescriptions filled correctly. 75% said it was always easy to use their retail pharmacy. And more than 72% of members reported a high score with the health plan. And out of those who wanted to refill their medications on the call, 96% were successfully transferred to the pharmacy. I should also mention, this isn't on the slide, but transportation was noted as a barrier to many enrollees. The health plan took note of this and to make outreach to these members to have them switch from retail to a mail order pharmacy setting. These numbers are great because they highlight not only how well the health plan is doing, but also provides proof that the plan is reducing administrative barriers while enhancing customer service measures. Personalized member outreach is crucial for driving engagement and ensuring necessary actions are taken. Additionally, tracking the outcomes of these outreach efforts is essential for determining effectiveness and reallocating resources from lower return on investment methods to strategies that generate better results. So to summarize, we have the 3 best practices for effective enrollee engagement. We want to move the needle by delivering content that is meaningful, relevant, trustworthy, and coordinated to improve outcomes, reduce cost, and enhance member engagement. Meaningful, meaning meaningful to the member, personalized, whole person approach with the SDOH barriers and other factors in mind. Trustworthy, communicating with empathy, what you say, how you say it, being culturally sensitive and culturally appropriate. Coordinated, meaning the right approach at the right time, strategic, beyond the message, and action-oriented. Think back to the member's journey. As a plan, you have the opportunity to engage with your members at multiple times and moments that matter, and your communication should be purpose-driven. Every member touch should always have a specific call to action. Leah, I'm going to pass it back to you for your final thoughts.
Thank you, Becca. Wonderful. Thank you all for joining us today as we discuss some important areas of identifying the most appropriate members for outreach at this time of the year, targeting those members in Medicare Advantage and D-SNP plans and those most vulnerable and needing social assistance, ensuring that they're aware of plan changes, and communicating empathy with personalized, proactive messaging through an omni-channel approach. And I just absolutely want to highlight the focus on gathering intel from your members through surveys and other information to address and identify those social needs. So thank you so much for attending our webinar today. We hope to talk to you soon.